So as the sheriff, I am also the director of emergency services. So the Office of uh, Emergency Services is part of the sheriff's office. This is fairly new. It's been in the works for quite a while, but given all of the process that has to be kind of gotten through to get there, that it actually became official per county ordinance on Friday the 15th. So it's very new, although me and my staff and the team at the Office of Emergency Services has been deeply involved in this, really, this being COVID since day one. Well, I mean, there had been rumors, more than rumors, some indicators that may come to pass. And so the team really just said, okay, if we're going to do that, how do we do that? And what does it look like? We also kind of, from a planning standpoint, went into it knowing that, a quick process like that, it's not going to be perfect. There's going to be an element of chaos to it. And I know, like on that very first morning, on Thursday morning, if you were out there, there were some long lines that were snaked around, people pointing in different directions where to go, but we truly viewed that as success, because I kind of go back to what I said, our ultimate goal is getting vaccine into people's arms. And so while we realize that there's an element of frustration, we are meeting that goal, and we're doing it quite well. Well, because the scenic site is not ideal for that volume. Parking is extremely limited. Everyone had to stand outside. There's not really the ability to have people kind of sheltered inside. And the driver for a lot of this is the 15 or 30-minute observation process at the back end of the vaccine to make sure that, and I just got a phone call that I'm trying to get rid of, to make sure that no one has an allergic reaction to it. And at Scenic specifically, we only had the capacity for 60 to 75 people in the observation rooms at any one time. So by moving it to Modesto Center Plaza, it's not only really in our downtown, there is a lot more parking there for the public to make use of. And it's really the biggest indoor facility that we have in Modesto that we can utilize between all of their meeting rooms and ballrooms and whatnot. There's a lot more space for people to, they're going to have to wait in line, but they can do it indoors by and large. I'm sure that there will still be some folks in the parking lot, but the space just makes it much easier. At least Thursday morning specifically, it was pretty cold outside. And, we realize, especially as we talk 65 plus, you have some folks that, we really don't want waiting in that type of environment. So if we can put them indoors, much better. And then on that observation side at the back end of the process, we have a lot more room. So we think we're going to be able to really ramp up our throughput even more, as long as we can get the vaccines to do it. That is our goal, yes. Now, with that, we have to have some additional staff that we're onboarding as well through paramedics and EMTs and volunteers and so on. But we are trying to get them in so that we have the staff needed to do that. But between the space, both for again, lining the folks up and then observing them at the back, and the additional staff that we're bringing on board, yeah, we do. We don't have a number. Part of what we're trying to do is under promise and over deliver. So we had said, we had told the board of supervisors that we were confident we could hit 1,000 a day at Scenic, and we hit 1,600 both days. And that's really our goal. We don't want to tell the public, oh, we can get 5,000 or something, and then not be able to attain that number. We want to give a realistic number and make sure that we can get them all through on any given day. So just like Modesto Center Plaza is kind of a partnership with the city of Modesto, and we certainly appreciate their involvement and their help in this. Same thing at Cal State down in Turlock, California State University, Stanislaus. And that's a partnership with the college. Again, they have some large indoor facilities that are not being used right now due to COVID. And they also have the ability to use some of their own staff, whether they're employees or some of their students that are in the medical field, to assist us with this. Well, kind of like I referenced earlier, the vaccine is the true solution to COVID-19. All of these other measures that we've had, as far as, wearing masks, social distancing, the shutdowns, closing things, all of that is solely there to slow the spread. So that we can maintain the hospital capacity, specifically the ICU bed capacity, to treat either COVID or any other medical emergency that may come up, heart attack, a car crash, whatever the case. The solution, though, is the vaccine. So we are trying to eliminate as much bureaucracy and move as fast as possible to get that vaccine out into people's arms. Let's face it, everybody out there wants to go back to work. They want their kids back in school. And if vaccine is the solution, we are not dragging our feet to get it out there and into people's arms. We would rather operate in a little bit of chaos or uncertainty than to operate slowly. So that has been kind of our whole push. Yeah. What I will tell you that most of what we've heard from those that went there, I mean, I'm talking 90% plus, is that yes, there's a wait line and a wait time, but quite frankly, it moved fairly quickly and efficiently. The shortest that I've heard is someone made it, door to door from their house to get the vaccine and back home 90 minutes. Most people probably in the 3 or 4 hour range. Depending on how part of it depends on how early they wanted to get in line. So there is some heartburn with that. Again, I'll say, we view it as a success because we're getting the vaccine in people's arms. Now, we that shouldn't be taken to mean that we are not going to make constant process improvements, right? So we're trying to bring more chairs out there for people to sit in. We had blankets, coffee delivered, water to try to keep the folks waiting in line as comfortable as they can. And probably the biggest gripe that we've heard, though, is why don't you go with some sort of online or telephonic reservation system, potentially a drive-through site, something like that. Specifically to the first point about a reservation system, I think we've seen since this began all of these new systems, this being COVID, since March, all of these new systems that have come into place and the delay that they have, the slowness that they have in getting some things done, right? Because the system crashes, the registration is slow, whatever the case may be. The same thing telephonically, same problem. You have to call and make an appointment. There's a certain that will slow our throughput. So the decision that we made, we are going to do this the simplest way possible, and that's having people line up and wait their turn. It's just simple and it's efficient as far as, again, going back to that number one goal, getting vaccine into people's arms. So yeah, at some level, we are asking people to inconvenience themselves if they want to come to the county's clinic, but it also lets us get the most vaccine into people's arms possible. And let me add to that. Vaccine is getting dispensed to other medical providers, doctors' offices, pharmacies, and so on. Many of those places are taking appointments. So, before you come down and wait in line at now the Modesto Center Plaza or at the Cal State facility or in Oakdale or in Patterson, when we open those facilities, check with whoever your doctor is, whatever clinic you use, whatever pharmacy you use, you might be able to schedule an appointment there, supply dependent.